The principle for the month of May is that educational supervision is of a high quality. To that effect, as a clinical supervisor, educational supervisor and college tutor, I always look for opportunities for our trainees. It is, however, important that we label the opportunities as well. On a day-to-day basis, say for example, if a trainee is just about to present a case, I could say, would you like me to do this as a case-based discussion, or when you examine the patient, would you like me to do this as a mini CEX? This helps focus their minds towards a specific work-based assessment. And there are numerous such opportunities. The second thing I would like to say is I would like to look for unique opportunities. So say, for example, all trainees need to have safeguarding CBDs. So rather than actually discussing the case, I would ask them, would you like to take minutes of a multidisciplinary team meeting? What this is going to do is not only focus their mind on the number of people who are attending, but also on the content of their contributions. I would pre-decide what the minutes should look like, which will help again focus their minds and make sure that the minutes are short as well as a good summary, but not too much jargon in them. The other thing I would like to recommend is to have trainee champions for various academic teaching sessions within your hospital. So for example, we have our neonatal teaching session called the Neonatal Tuesday Club, and we have an assigned trainee as our Tuesday Club champion. Likewise, we have sunrise sessions, which are evidence-based medicine session, and we have a similar champion. What this will offer is it'll focus the trainee's mind. It'll also offer them a leadership opportunity, and it will be something that they can make their own and gain a lot more than if they were not champions. The last thing I would like to say is that have fun. It is important when a trainee is with us within a certain hospital that they feel included into the team. We have things like Bun Wednesdays where there is a bun rota, and trainees as well as consultants and non-training doctors and nurse practitioners would be assigned days when they would bring buns for the rest of the team. This is a team building exercise which doesn't take too much of effort but really has good rewards. Overall, I'm sure you all are doing a superb job looking after trainees, championing for their rights as well as their training needs. Thank you very much for listening.
Hello, my name's Kumudini Gomez and I'm a General Paediatric Consultant from Lewisham Hospital in London. I'm also one of the training programme directors for South London Paediatrics, and I manage the ST4 to 5 programme. I've been asked to give my thoughts today on the Progress Plus principle. Educational supervision is of high quality and provides consistency. What does this principle mean to me in my day-to-day work? Well, I do believe that good educational, also clinical supervision can make or break life for a trainee. Pediatrics and much of medicine is very challenging, and I think good supervisors can foster a really supportive learning environment. A good educational supervisor will then allow that trainee to ask lots of questions as they're going along, and I mean more sort of personal developmental type questions rather than clinical questions, and enable them to explore different career pathways. The difference between educational supervisor and an clinical supervisor would also be that the educational supervisor should monitor that trainee's progress. So, for example, making sure that they're on track with their exams, and if not, then trying to identify ways of helping and supporting them or signposting them to resources. And they also have a role in guiding the personal and professional development of that trainee. Why is this so important? I think good educational supervision can really be career and life changing for a trainee. It can have a lasting impact on a trainee, and to me, a thank you from a trainee for having helped them in whichever aspect that they've asked for that help means an awful lot, as much as any thank you from a patient for the care that I provided. Some tips on what you could do if you want to improve your education supervision skills. My first thing would be, when you are meeting that trainee for the first time, make sure that you've read their e-portfolio. For those trainees who are starting out in paediatrics for the first time, ask them for a CV. In the same way that you would never meet a patient without actually having read the referral letter or looked through their clinical notes. I really don't think it's acceptable to meet with a trainee without actually having read through their e-portfolio. I am amazed at the amount of things lots of these trainees have done from medical student stage onwards, and it hopefully shows them that you actually are interested in them, if you actually know a little bit and have taken the time to read up on their past career leading up to when you're meeting them. I think it's really important that an education supervisor keeps up to date with all the changes that are happening. As I know, lots of trainees will complain that actually they know more, for example, about e-portfolio and Kaizen than their supervisors do. And I think one of the best ways that supervisors can do that actually is helping to assess ARCPs on a regular basis if you have the chance, because then you get to see the way feedback can be given in training reports, how different people or different departments have tackled any issues that might be coming up, and also learn about the importance of signposting trainees at different points in their career. I think it's really important also that if you don't know the answer to a question that a trainee is asking, that you are able to know where to go for help and signpost that trainee accordingly. One of the key differences between education and clinical supervision is that career guidance, and I think that is really, really important. So I hope that the department that you work in also tries to marry up trainees with supervisors according to their area of interest, for example, if they know that. I also think it's really important that a good supervisor doesn't shy away from a difficult conversation. It's always lovely to have lovely conversations and always be very positive with the trainee, but actually if they do need to be made aware of something that is of concern or could be of concern that's been identified by the local faculty group, then I think it's really important that those conversations do take place, obviously in a very supportive manner, and that you're then able to signpost the trainee to resources, for example, where needed. I think also for your own development, if you can get some feedback from your trainees, then I think that's also very useful and much more meaningful as well for your own career development. Progress Plus also talks about longitudinal supervision, for example, an educational supervisor who will oversee the trainee through the whole of core paediatrics, which would be SD 1 to 4, and the specialty paediatrics, which would be SD 5 to 7. I think this is a wonderful principle. I know that some regions are almost have this embedded already, and there are other regions, for example in London, where I think the sheer number of trainees makes this much more challenging. But I do think that it is something that would be good to work towards. I know that many trainees have said that it's quite demoralising having to give their life story to a new person every 6 months as they rotate through departments. And I'm sure we would feel exactly the same if that's what we had to do. So I think that is a very good principle for all of us to work towards from now, and particularly when shape of training comes into play. Thank you.